Hi everyone, my name is Kendra and I am one of the providers at Psychiatric Wellness, and I am here today to talk to you about AI psychosis. So this is a term that has emerged to describe a concerning phenomenon where individuals experience the sudden onset of delusions, paranoia, and other psychotic symptoms after prolonged or intensive use of AI chatbots. So while this is not a formal clinical diagnosis, there have been some accounts from mental health professionals and affected individuals that highlight a dangerous new intersection of technology and mental health. So I'm going to talk about today what is AI psychosis, its potential causes, and who is at most risk, and then also provide some actionable interventions to help prevent it. So starting off on what is AI psychosis, the symptoms, causes. AI psychosis lies in the way that AI chatbots are designed and how vulnerable individuals interact with them. The symptoms often mirror those of a psychotic episode and include delusions such as an unshakable belief that the AI has some sort of special knowledge or is a divine being or part of conspiracy, might tell somebody that their neighbors are spying on them and it's easy to believe. Also, disordered thinking. The thought patterns can become confused, illogical, with conversations shifting abruptly. Also, hallucinations and emotional or behavioral changes. If you notice that somebody is becoming withdrawn from friends and family or agitated when becoming separated from AI, that would be a noticeable trait to keep an eye out for. So, psychiatrists and researchers are pointing to several key factors that may contribute to AI psychosis, one of which being a problem of reinforcement. So, unlike human therapists or real life conversations, the purpose of the AI chatbot is designed just for engagement, and it mirrors the user's language, their tone, and often validates any sort of beliefs that the person may have contributed to keep the conversation going. And so this can be dangerous in the way that it might amplify existing or developing delusional thinking, and just creating this self-reinforcing echo chamber. There's also the lure of AI appearing as some sort of oracle, since AI's ability to provide plausible sounding answer to a question can lead people to deify the technology in a way, viewing it as a source of like truth or divine revelation, and it can be risky for people who are already prone to magical thinking. AI also has the illusion of companion. So for people who are experiencing loneliness, isolation, emotional distress, the chatbot can become a constant and seemingly empathetic companion that can lead to some emotional dependency and blurring the lines between AI being a tool and an actual sentient being. There's also some concern about cognitive offloading, where there is a heavy reliance on AI tools being used to help with critical thinking and problem solving that weakens the individual's ability to engage in their own independent analysis and reality testing, which just makes them more susceptible to the AI's influence. So moving on to who is most at risk. Anyone can be affected, but there are certain groups and circumstances that appear to increase an individual's vulnerability to AI psychosis, such as those who have pre-existing disorders such as schizophrenia or bipolar. Those individuals may have an exacerbated heightened risk for being influenced by an AI chatbot. Also, those who have social isolation and loneliness, any individuals who have gone through a period of stress or trauma, maybe dealing with grief, may find themselves more vulnerable. It is important to just set some interventions and clear boundaries for families and individuals. And so this can include treating AI like any other screen time activity, setting a time limit and sticking to it. Avoid using AI late at night or when feeling emotionally vulnerable. And to try and maintain real world connections. Actively prioritizing your investment in human relationships, engaging with friends, family, the community, and seeking out real world activities and hobbies, and using that as a vital reality check. And to recognize what AI is for what it is. It's a tool and not a person. And understanding that these chatbots are just sophisticated pattern matching algorithms. They're not real people. They do not have emotions, beliefs, or personal experiences. They're just designed to mimic human conversation and not be a replacement for it. So look for the red flags, be aware of warning signs in yourself or a loved one. And if your loved one is showing signs of psychosis or an unhealthy dependency on AI, it is just crucial to seek help from a mental health professional, and even using resources like the 988 Suicide and Crisis Lifeline, or immediately seeking other mental health services. So if you have any questions, please reach out, and thank you.